Hi, my name is Norris. I am a Pima Medical Institute student, and this is my vlog on metastasis. What is metastasis? Metastasis is a word made of two parts, meta, out of, and stasis, which means control. It is used to indicate the spread of cancerous tumors throughout the body. Types of metastatic spreading. There is hematogenous, which means it spreads through the circulatory system through the blood. A cancer cell can find a way into a blood vessel or a vein and spread around into the body and find a new location to create new tumors. Or through the lymphatic, which means it can go anywhere in the body, just like the blood, because as you can see in the picture, the lymphatic system goes anywhere in the body. Transcelomic, which means the cancer cells can spread through the body in the abdominal or chest cavity, or growth, which means the cancerous tumor or cells will just reproduce and make a bigger tumor and grow into the surrounding tissue. This is a video demonstrating how hematogenous metastasis work and how it spreads, and it is by Cancer Quest.
Spread of tumors to distant locations is of great importance in cancer. About 90% of the deaths due to cancer involve tumors that have spread around the body. The movement of tumor cells to other parts of the body is known as metastasis. Metastasis is a complex process during which cancer cells break off of the original or primary tumor and move through the body to form tumors at new locations. From the point of view of a cancer cell, this is a dangerous and often unsuccessful process. A trip through the body is full of hazards that cause the death of most cells that begin the journey, even tough cancer cells. To begin the process, individual cells must break away from the tumor and invade nearby vessels. The cells crawl along the surface of other cells and the fibrous, stringy structure surrounding them and then force their way in. Shown here is the invasion of the blood supply. Once inside a blood vessel, the cancer cells may perish from a variety of causes. Some cells die simply because they are unable to survive floating around in the bloodstream. Others may become damaged and die when they squeeze through tight spaces or bump into the walls of the blood vessels. Still, other migrating cells may be recognized and destroyed by cells of the immune system. How and where the migrating cells stop is different for different cancer types. Once the tumor cells are no longer moving, they can begin the process of forming a new tumor by leaving the blood vessel and beginning to reproduce in the new location. This does not always occur, and cells that have made it this far may still die or fail to divide. If the new environment is suitable, the newly arrived cell will begin to grow and a new tumor will develop.
These are the different types of cancer that are likely to metastasize. These include but aren't limited to breast cancer, prostate cancer, lung cancer, kidney cancer, thyroid cancer, colon cancer, pancreatic cancer, bone cancer, and liver cancer. As you can see, most types of cancers can metastasize and spread to different parts in the body. Why is metastatic cancer so dangerous? Metastatic cancer is the cause of 90% of cancer deaths around the world. A lot of cancer cells that grow and find a way into a new location get detected and killed by phagocytes, which are the white blood cells. However, the ones that do make it are a stronger version of the original cancer because they are undetectable by the body. Some of them can also be dormant for a long time, which means a patient might stop treatment thinking it's over, but it will come back a few years later. It also takes over your body, changing many cells to invasive ones that aren't effective. How metastatic cancer is detected. Cancer is always detected through tumors. Usually The likelihood of getting it depends on your medical history and your family's medical history as well. Metastatic cancer is only discovered after it have spread into a new location or came back after the healing process. These are some of the different methods of detection. There's physical examination, x-ray, bone scans, computed tomography, which is basically a CAT scan, magnetic resonance imaging, or blood tests. There are other things, but these are the ones that I have included. These are the current treatments available for cancer or metastatic cancer. There is surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell or bone marrow transplants, or hormone therapy. Surgery. Surgery can be used to diagnose through biopsy, which is a sample of a tumor to see whether it's cancer or not, to stage cancer, so the organs, tissue, or lymph nodes surrounding the cancer is examined to see whether the cancer have spread into that area or not. Could be used as curative to completely remove a cancerous tumor, debulking to remove some of the tumor as much as the surgeon can remove without damaging the organs nearby, because sometimes it's very large and close to these organs. It could be prophylactic, so to cut a part of the body that is at high risk of obtaining cancer. An example could be mastectomy, the removal of a breast. Reconstructive, so to replace or reconstruct a removed organ. Another same example could be used, mastectomy, so after they remove the breast they could add implants or a flap of tissue from somewhere else of the body to replace that organ. Chemotherapy is another treatment for cancer. It comes in many different types that include pills or IV infusions through the blood. It works by killing cells that reproduce, so it kills cancer cells. However, because of how it works, it takes a huge toll on the body. That's because it is made to kill cells, so it is killing your body cells at the same time. It is usually combined with radiation therapy or targeted therapy in order to get rid of the cancer as fast as possible before it has a chance to spread into another location in the body. Radiation therapy. Radiation therapy is basically the use of a device that emits radiation onto the area of cancer to destroy the DNA of these cancer cells, killing them. This can also kill nearby normal cells of the body, but most of the time they can regenerate and new ones will replace them. It is one of the most common cancer treatments. In fact, it is used for more than half types of cancers around the world. Sometimes it is used after tumor removing surgery in order to kill off any cancer cells left, so there is no reoccurring of cancer. How to detect tumors or metastatic tumors. Physical examinations of one's body areas that are likely to get cancer, usually the chest area or genitals. If you find a lump or a tumor, you must get it checked out by a doctor and get a biopsy to be sure whether it's cancer or not. Being aware of cancer symptoms and signs, such as loss of appetite or loss of weight without trying to. Annual doctor checkups. It might take a lot of money, but your health is more important, and it is important to stay safe. Be aware of family medical history. If your family has a history of cancer, pay close attention to your health and the symptoms that come from that specific cancer that they had, so you will know when it's happening to you or not. How to avoid cancer in the first place. Don't smoke tobacco, as it is known for being the #1 cause of lung cancer. Eat a healthy diet consisting of fruits, vegetables, and healthy proteins while avoiding highly processed foods, as they are known to cause cancer as well. Maintain a healthy weight. It will benefit your health in so many ways and not just preventing cancer. Protect yourself from UV radiation by covering exposed skin from the sun or wearing sunscreen. This also includes tanning beds, as they are also damaging, just like the sun, or even worse, because they also have UV radiation. Avoid unsafe behavior such as unprotected sexual activity or sharing needles, because they can transfer all sorts of diseases that could ruin your life, and it isn't worth it. To conclude, metastatic cancer is the worst type of cancer that can take over your body. There are many different ways to cure or treat this type of cancer, but we have not yet found a solution to fully end it or stop it from reoccurring. This is why the best thing to do is avoid cancer at all costs. Sometimes cancer is inherited, and a person cannot really avoid it, but that doesn't mean we shouldn't stay safe and avoid bringing it upon ourselves. These are my references and all the websites that I used to conduct my research for this vlog. Thank you for watching and have a great day.